Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating young woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Hello, everyone. My name is Ebony Johnson. I am currently based in Atlanta, Georgia, and I am a social epidemiologist and health equity researcher. I am also the founder and principal consultant of Ashae Analytics. We are a health research consultancy looking to provide data-based insights for health justice. I originally hail from New Jersey, specifically Bridgeton, New Jersey, and I am the daughter of a Jamaican immigrant and an English immigrant who is also the son of Jamaican immigrants to England. And then they came here. So have a lot of different cultures that make me who I am. I have my PhD in sociology from the University of Michigan, as well as my master's in epidemiologic science from the same institution. And then from Rutgers University, I have a joint bachelor's in public health and women's and gender studies. And how I came to do health equity and health justice research, I had always been just very interested in the brain, how it functions, just all the different mechanisms and how little we know about it. So, like many children of immigrants, I went to school to become a doctor, wanted to be a neurologist. And while I was taking these biology courses, I realized that I just didn't enjoy what I was learning. I didn't enjoy the memorization process. And I was complaining about this to a coworker at the time. I was working at a work study job on campus, and she was telling me that she had the same problem going into medicine. She was also a child of immigrants, so she shared my frustrations. And she was a year older than me, and she told me about public health, which was a new major at the time. I think it started the year before I came in. And she was like, I really enjoy it. It's basically like being a doctor for an entire population. And it's a lot more interdisciplinary. You can really kind of carve out your own space in it. And I was like, okay, well, let me check it out. And I took 2 classes that next semester in public health, one on just public health 101 and one on public health, public policy, and urban planning, and immediately fell in love. And I had always been a fan of math and just numbers in general. So once I took my first epidemiology course, I knew that, this was it. And I continued in that same space of brain research, but decided to go on the neurologicals and science and psychiatric epidemiology route, and looking at health equity and how we can use social policy to create more equitable health outcomes. So that is what led me here. And now I am an incoming postdoc at Emory University, where I will be looking at youth participatory action research strategies to prevent gun violence, and also looking at economic policies that'll prevent gun violence as well. So with that, alongside my personal consultancy, where I have an amazing team behind me trying to bring about better research methods, more community structured methods. We are really trying to carve out a space where everyone has optimal health outcomes. I am the mother of two amazing cats who also get on my nerves, had to lock them in the room. In my personal life, I love to bake. I just was bested by some mini cheesecakes over this weekend, uh, trying to figure out how not to make them crack. But I also love just going outside for walks. I'm also a competitive power lifter in my free time. However, I'm on a mini sabbatical from that until next year. And I also just enjoy watching history documentaries, a huge history buff in my free time, and hanging out with friends. I definitely love to look at social connections as a uh, way to make better health outcomes. So that is really something that I try to install into my personal life. So definitely start linking up with your friends.
Ebony, thank you so much for coming online and sharing your story with us today. It
Thank you
always
for having me.
when I meet women in STEM, women in the sciences, really carving out a path for other women of color to do the same. So, your career has been dedicated to promoting health equity and wellness.
Correct.
You share the pivotal point or moment in time that inspired you to focus on health justice.
Mm-hmm. Yeah, so like I said, I went into college thinking I'm going to be a doctor. And really, it wasn't that I couldn't do it, I just didn't like to do it. um, I took the biology 101, the chemistry 101, and it really just wasn't working for who I was. And I had to sit down and really just take that in and say, okay, so who am I? What do I actually want to do? And having that conversation with my coworker who had already had that conversation with herself and decided I actually want to make a wider difference and not do essentially doctoring on the individual level, but I want to do it for populations, and I want to look at data and policy and how I can go about that way. And I followed her lead and realized that's actually what I wanted to do as well. So just being able to open up my eyes to new opportunities and really see what is the things that I like to do and not kind of just go the direction that people expect me to go.
That's just awesome. Your work integrates epidemiological insights with sociological perspectives.
Mm.
How do these two disciplines complement each other in addressing health disparities?
So that's a question that I actually get pretty frequently, which always surprises me. Any type of health outcome is structured by some type of social structure that we have in our society. And specifically with sociology and epidemiology, I really wanted to have that both methodological as well as theoretical background and expertise into health justice and how to just be able to talk to different communities. So talking to the STEM community and the doctors with the epidemiological side of things, but then also talking to the policymakers and the social scientists with the sociology part of things was something that I came into my graduate studies really trying to hone in on. But there's this budging field of social epidemiology that is picking up a lot of steam currently, and it's looking at the social structures and social factors that influence health outcomes, and also the different ways that we can measure that, because social factors are very hard to measure, as you can think of, and a lot of the health outcomes that come from them take a long time to actually be able to really look out. So there's a lot of longitudinal studies that we would have to do, and a lot of methodological issues that come with that. But what I like to argue is that all epidemiology is inherently social epidemiology, whether it's, nutrition is nutritional epidemiology is like, well, what food do you have access to in your community? And what foods did you grow up with your culture? And just all of those things, or like even genetic epidemiology, which you would think is just very science, STEM focused, like not really any social factors, but it's also, what region did your lineage come from that would give you certain traits compared to others, and where did they migrate to, and also what type of environmental factors were you around due to, you know, your income that may have had a created genetic predispositions. So
Mhm.
that's really something that I've been trying to argue with in my field, and it seems like it's picking up traction. Of course, I'm not the only one arguing for this, but I'm really
Mhm.
glad to see that more social factors are coming into these STEM spaces and more interdisciplinary work is being done in health research.
That's wonderful. So, you've developed strategies to promote sustainable health systems in marginalized communities. Could you discuss one of these strategies that has had the most significant impact?
Yeah, so one of the things is definitely just looking at equitable health research with communities and understanding that communities are the experts of their own research and their own identities and their own outcomes and their own data. And in order to build a sustainable health system, sustainable health outcomes, you must include this community in every step of the research process, from contemplating what it's going to look like down to the communication at the end, how you disseminate the information, and also being able to understand, while you may have good intentions, maybe the institution that you're working for, such as a government or academia, may have had a bad relationship in the past with this community, and trying to understand how can I navigate that space even if I may be coming in with the best intentions. So understanding, the structural issues that come with research and how communities have been exploited over time. So one of the things that I did when I was in graduate school at the University of Michigan was I was the program assistant for their Ginsberg Center for Community Health and Service Learning. And I was in charge of creating the curriculum as well as holding workshops for different community organizations, student organizations, classrooms on equitable academic and community partnerships. And we really promoted the fact that, yes, you may have the best intentions, but you also aren't the experts in what you're trying to do
Mhm.
within the community. And also, you are a part of a larger institution who may not have the best intentions or may not have had them in the past, and
Yes.
how can we best navigate that. And just keeping that in mind in general is such a great first step. So that was one of the experiences that really brought me to where I am, and just trying to understand community engaged research in general.
Okay. So, stress management and cognitive well being are critical aspects of holistic health.
Mm.
What practices do you recommend for maintaining mental and emotional balance, especially for women in demanding roles?
That is a great question. And that's actually one of the big parts of the dissertation that I wrote. It was all about stress factors and that impact on cognitive health across the life course. But mine was mainly looking at methodological issues, like I was saying, with longitudinal studies and just tracking health over time. But I would say for just day to day types of tips, definitely exercise. Trying to fit that in as much as possible. It really keeps a clear head and helps with just health overall. And making sure that you work with someone who is knowledgeable in this area, especially if you have some type of mobility limitations, just so you can figure out what's the best way to work within the exercise space to be able to do what you want to do without hurting yourself further. Additionally, social connections are always so important. I think definitely in at least the United States, not sure how it is in Australia, but we're very individualistic and very focused on the nuclear family. And that's not always the best for mental health. We definitely need community. We definitely need friendships outside of our family. And that's social isolation is such a big part of the mental health crises that we're seeing now, especially with people working such long hours and hardly having any time to them to be able to be social in these spaces. So that's something that I definitely think if you can, please prioritize your friendships and your community and having hobbies where you get to meet other people. And lastly, I will definitely say sunshine. Just step outside for like 5 minutes. It makes such a difference. Uh, Again, with work-life balance, people tend to go to work for 8 hours before the sun comes up, get home. A lot of times the sun is already setting, and we're just in the house trying to cook, trying to get ourselves together for the next day. And we really just don't take the time to step outside and breathe fresh air. And even just taking a walk and listening to the sound of nature is such a great meditation technique. And it really just does wonders for mental health and cognitive health over the lifetime.
Lifestyle choices play a critical role, like you're saying, in overall health. What are some of the key lifestyle challenges that can lead to improved health outcomes, and how can they be implemented on an everyday basis?
I'm sorry, could you elaborate on that question?
So, we're talking about lifestyle choices playing a critical
Mhm.
role in your overall health.
Mhm.
What are some of the key changes, lifestyle changes, that can lead to an improved health outcome?
Yeah, so some of the key lifestyle changes is one, just changing the way that you look at doing a lot of these things.
Mhm.
Some people think that, oh, this is just another task to do, and I don't have time in my schedule to do it, which a lot of times is very true. But I think looking at it as these are the things that I need to do to keep myself sane and keep myself healthy. And at least for me, I hate cleaning, hate it so much. But when I do the dishes, I have taught myself to think, okay, while I'm doing this, I don't have to think of anything else that I need to do because I know I need to do this to keep myself sane and to keep my place happy. And like I don't need to clean the bathroom while I'm doing the dishes. Not going to
Yes.
think about that. I don't need to exercise while I'm doing these dishes. So I'm not going to think about that. And I think a lot of the things that people do is think about the 5 million other things that they have to get to
Mhm.
while
Comes
they're
overwhelming.
trying to keep themselves uh, mentally happy, cognitively happy, and it really hinders their growth within that space. And that's definitely something I am still working on. So definitely a hard thing to do, given that we usually have a million things to do, but it's really just a change of mindset that's been helping me over time.
Okay. So now let's delve into business and entrepreneurship.
Mhm.
As the founder of Ashae Analytics, I hope I'm saying it right.
Ashe.
Jay, okay. You've
Mhm.
built a business focused on advancing health justice. What are some of the initial challenges that you faced, and how did you overcome them?
So, one of the initial challenges that I faced was just trying to understand what my niche would be. I
Mhm.
think there's so many different things that you could focus on within one, the research space in general, but also health space as well. There's, I mean, health tech, there's AI, there's a bunch of different types of things. But I really had to sit down and think, what are the things that I have created my life to look like to be good at this point. And
Well,
I've done a bunch of research by this point, and I've also done a lot of policy work. So I thought, well, health justice. We're looking at health in general, which I have this epidemiological background and social determinants of health background, and then really trying to break down structures that are preventing optimal health outcomes. So looking at the justice piece of things, which is really bringing in the law and the policy and those types of issues that are very structural. And then I would say the second thing was trying to figure out, okay, now how am I going to actually make my vision come to life? and I know, and I had to really sit down and think, all right, what are my strengths and weaknesses? I know one of my strengths is project management, because I just love organizing things and just actually seeing the vision come to life. But I know that I am not much of a networker or a social person, very much an introvert. So I'm like, well, who of my friends could I bring on who I know is very extroverted and but still has that research backgrounds that I am looking for, and maybe they don't like to do the project management side of things. So that's the part that I can take on. And it's really just supplementing my strengths and weaknesses with others in my network who can really push this thing forward, and not trying to see this company as an entity of myself, but just an entity of the work that we're trying to accomplish.
I love that. You have to find people who complement your weaknesses when you're building a business. That's for sure.
Absolutely. Absolutely.
So building a mission-driven business requires a very strong vision. How did you define and articulate the mission of Ashae Analytics, and how has it guided your journey?
Yeah, that's a great question. So what I was looking at was, okay, what is my optimal vision? Essentially just creating the vision statement and then trying to think, okay, and so what am I going to do to try and help us get there? So I wanted a world where we don't have to think about the social determinants of health, and we don't have to think about health equity and health justice, because a lot of the things that we want to do in life are hindered by the things that not only we can't do due to social structures, but also the things that are constantly within our minds that we have to ruminate on, especially with just marginalized communities. And I just want us to have that free mental space to not have to think about these things all the time. So from that vision, I kind of built the company around that. So, how can we promote mental wellness while also breaking down structures? And going from there and realizing that social structures are so encompassing. So we really need to figure out who to bring on board. So I have someone who focuses on biostatistics. So she is our data whisperer. She knows everything on that end. I have someone who focuses on environmental issues. And I have someone who focuses on media and communications, and then someone who focuses on learning design, and just trying to figure out what are all of these different silos that we can bring together to make this vision a reality.
Now, sustainability is vital for any business, especially those with a social impact mission. What strategies have you employed to ensure the sustainability of Ashae Analytics?
So one of the things I really wanted to think about as far as sustainability is looking at where research is going and seeing how we can supplement that. So, research is very tech focused right now, very AI focused. So I wanted to have someone who could guide me towards how can we understand that space and also possibly become a part of it. So, and then as well as just understanding how can we go further within the spaces that we're already in, such as research and policy. So one of the things I really was fixed on doing in the first few months of the business is creating an advisory board. I think
Okay.
everyone needs some people who have been in the field for quite some time to advise them on how to move forward, because they can see a lot of the things that you can't see, and they know how things have changed over time. So I'm currently in the process of creating that. I've reached out to some great mentors I've had over the years, and even some friends that I know who are in these different spaces that I may want to tap into the future. And I think that's just such a big part of sustainability, is really being able to reach out to others and let them guide you to the places that you want to go.
What advice would you give to aspiring entrepreneurs who want to create a business that address social issues?
I would give them the advice to not think too long on it and just start doing. I think a lot of us uh, tend to be wanting perfect opportunities or perfect environments to create this change. And a lot of times there's no such thing as perfect in general. So we really just can't just sit and hope for the best. We have to create the best. And just moving forward and having an understanding of who you are, and have an understanding of all the good that you can do, and being confident in that, and knowing that I do have something to give to the world and to promote, and I do have these skills and these gifts that will
Yeah.
create community.
If I could take you back, we're going to have a little thought experiment with my last two questions.
I love thought
I could
experiment.
take you back to the past, to that young woman, that young girl who decided to step into the field of STEM in terms of your degree and now your career. If we could go back and have a conversation with her and give her three nuggets of wisdom based on what life has taught you up until this point, what would you have wanted somebody to have told you in anticipation for your journey?
I would say, one, that your journey may not look the way that you plan it, and that's okay. That's more than okay. It's pretty normal. uh, Nothing is ever going to go exactly the way you plan. I think the saying is God laughs at your plans. So that is definitely number one. Number two is try to create a network, and don't look at it as, trying to strategize for the future, but really just try to create people, create friends in professional settings. I think that's really what networking is. And being able to network organically, and not just going into situations thinking I just need to meet people, but really just saying, hey, maybe this situation is very interesting, and if I meet people, that's great. That's definitely a introvert's conversation. And I would say the third thing is making sure that you're not beating yourself up on the small things. Everyone makes mistakes. No one is perfect, and you will continue to make mistakes, and that's okay. That is a part of learning. You learn from that. That is a great process, honestly, to create a better life. So those are my three things.
I love it. Now I'm going to teleport you into the future.
Ooh,
We are going to go and have a conversation with a 90-year-old you,
wow.
this wise woman who's led you to this point. What will you say to her when you finally meet her?
Well, hello, older Ed. You have lived an amazing life. You have achieved so much, and you have loved so much, and you have done so much change within the small amount of time that God gives you on earth, or whatever higher being there is. And you are truly loved by your younger self. Another thing is, wow, you really did all the things that you wanted to do, even if you had to change your plans a couple of times, even if you had to change your mind a couple of times, or change your sense of self. You really did what you wanted to do. And third, I would say, Great job creating a community that has led you into this old age, holding on to your values and to your sense of self that you have nurtured over this time. And I hope you have a great rest of your years.
You know, the reason why I like to ask that question, Ebony, I ask every single one of my
I
guests.
love that question.
The wise woman is already in us, right? A lot of women don't realize that you are born with all of the knowings, everything you need to achieve your dreams, but we doubt ourselves as women. We
Very
don't
much.
that inner voice, that little whisper that says, go left, go right, say yes, say no. And we look for the answers outside of ourselves all the time.
Mm.
So I always end my podcast with this, just to remind women that she's already here. I personally work with the energy of who I am becoming.
Mm.
I go into my meditation, my prayers, and I ask myself simple things like, what is the next step when I get stuck, right? And I sleep on that. And then I wake up. Most of my stuff comes through my dreams. I have these light bulb moments the next day, and it's like the answer is right there in front of me. Or I talk to people. I talk to people about what I'm working on, and then it's a chain of events. You know, I'll talk to one person who says something, and then the next one says something, and by the end of the week, the end of the day, I've got the solution. So thank you so much for being an example of what's possible when you have determination and you have focus and you really want to make a difference, especially as an entrepreneur. I love social entrepreneurs where we are making money to make a difference in the world. So kudos to you for everything you're doing.
Kudos to you as well. Thank you for the thought experiment. I love that.
And thank you to everybody who tuned in today. The Her Story Circle is a movement. We are a movement of women from all over the world, sharing our stories to uplift, energize, and inspire. So tune in again tomorrow when I interview yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. Thanks again, Ebony.
Thank you. And thank you, everyone, for listening.
Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making